$410 billion given charitably in the United States. Of that, we've typically seen healthcare get about 8%. This year, that number actually eked up to 9%, and that resulted in $38 billion given to health causes in the United States. Now, that large number is inclusive of a variety of healthcare causes. It's, for example, not only to our nation's not-for-profit hospitals, but also to disease organizations, research organizations, and other affiliated healthcare organizations. So I think it's helpful to push that number down a little bit further and look at what is actually going to our nation's U.S. not-for-profit hospitals. That number in the most recent study that came out equated to over $10 billion. And as you can see from the trend line on that slide, it's been an upward growing trend line fairly consistently, with two exceptions: immediately after 9/11 and in the wake of the recession. However, overall, it's been a growing and sustainable revenue resource. The other thing that we see is, as more organizations are starting to raise money, it is not a pie that is further divided. Simply, if you live in Albuquerque, you don't tend to give to a hospital in Cincinnati. If you live in Jacksonville, Florida, you don't tend to give to a hospital in Chicago. Your giving tends to follow your experience. Your giving tends to follow where you would anticipate turning for your own care if you ever had the need. And so we find that philanthropy over and over again is local, and it's a local opportunity for you to tap and for you to leverage.